Hello, it's August 11th, and as of this morning, we have 67 patients with COVID-19 in our Shannon facilities. Of that 67, 12 are in our ICU, and what we've actually seen since early this week is a real increase in people coming to the ED and needing to be hospitalized. So I'm here with Dr. Doug Schultz, Chief Medical Officer for Shannon Clinic, and we're going to just update you guys on what's going on as far as healthcare in the Concho Valley. Just in talking about what is the ages that we're actually seeing needing to be hospitalized?
You know, right now the age range is very large. It goes from 97 years old all the way down to 14. So it's encompassing every age group right now, pretty much.
This is a little bit different from the last COVID-19 hospitalizations that we saw during the first wave, because those ages tended to be older.
Yes, the first wave definitely was hitting the older population, certainly over 65, some in the 50s, but this one's much different.
There's a lot of talk about vaccination, those who are being vaccinated, those who have not been vaccinated. What are we seeing in terms of testing as well as admissions in terms of Shannon and the Concho Valley?
Here in the Concho Valley, about 8 out of 10 people who are positive are not vaccinated. And the same really applies to those in the hospital. About 8 out of 10 that are in the hospital have not had the vaccine.
In terms of symptoms with the Delta variant, are they different from the first wave versus this Delta variant?
You know, this Delta variant it's different in several ways. It's very much more contagious than the original one, probably twice as contagious, and it hits you faster, so you get sick more quickly. And then thirdly, it's affecting younger people, as we just talked about. The symptoms are actually almost the same. They're not that much different than the original variant.
You know, we've heard in some of the news that if you haven't been vaccinated but get the Delta variant, that sometimes your symptoms are more severe. Is that the case? Or?
That's true. If you're vaccinated, you may still get infected, but you're going to have a much more mild version of the infection than the unvaccinated person. And probably almost not 100%, but pretty good chance you will not end up in the hospital if you're vaccinated. And
that, of course, that goes back to what you already said. 8 out of 10 of those being admitted into the hospital are people who are not vaccinated.
Correct.
Yeah. Tell me, you know, one of the things with this increase in patients needing hospitalizations, specifically in the Concho Valley, that we're seeing now towards the early part of this week. Talk to me a little bit about the ED and the hospital beds in terms of how we're doing.
Yeah, great question. You know, hospitals, Shannon Hospital and probably most hospitals are set up for surges. They can expand and take in more people, and it's busier, and that's not unusual. You know, in the wintertime, there's usually more sick people. So in that respect, we have the ability to, you know, to see more people in a surge situation. This one is large enough, though, that it's you know, it's stressing our system. So we're going to have to put some plans in place over and above what we normally do. So, you know, we can talk through some of those.
I think a little bit what's unique to us in this case is last time we saw, one is this in terms of the Delta variant, the surge is a lot more steeper. So it's surging quicker than the last wave. And also, when we saw hospitalizations this high in the past, around late October all the way through pretty much late January, we had a lot of help from the state. So the state was helping us by sending nursing and other healthcare professionals to San Angelo to help us deal with the capacity. And today what's happening is we have the beds physically, we just don't have the staff to open those additional beds. And so we're getting to a point with this last surge that happened in the early part of this week that's stretching our staffing resources. And we have the beds to expand, we just don't have the staff. And we're hoping that soon the state will be able to send us some staffing. What we're dealing with is exactly what's going on in other parts of the state, such as Midland, Odessa, Abilene, Lubbock, as well as all of us are hearing the stories around the Metroplex in Austin and Houston areas. Other things that we're doing is that we have reached out to a lot of those that have retired from Shannon, and we have basically at least 20 of those retirees are going to come back and help us. Something that happens to us when it comes to when our bed capacity gets stretched, we have patients coming through our ED. As they come through our ED, they may or may not need a bed. So if they need a bed, but we're at a point that we're full in terms of our bed capacity, they have to hold in our ED until a bed becomes available. And so we've been working on that quite a bit, and we're trying to, with our bed capacity being stretched, we're holding more patients in our ED, which is not what we like to see. So what we're trying to do is expand our urgent cares. And in fact, just yesterday, I know you worked on this with several of our leaders. We started today expanding our urgent care hours, specifically at our West Urgent Care. It would close at 7 p.m. Now it's open from 7 to 10. And one is we're trying to take a little bit of the pressure off the ED by expanding those hours. So Monday through Friday, we're keeping that open to 10 at the West Urgent Care. And of course, the other urgent cares are open till 7, which would, so for non-emergency type services. Other access points would be our telemedicine. So if you do not feel well and want to get checked out, you can try our telehealth services at Shannon On Demand. The other focal point that we're looking at, and this is easier said than done, but we're looking to reschedule what we would refer to as non-emergent surgeries. Now this is easier said than done, and we're working with our surgeons on potential cases that would require a bed and maybe we can wait. We don't like to do that, but we feel like we're probably going to need to do that in order to keep our bed capacity open for the COVID situation. Of course, a lot of this can be prevented through different means. And can you talk a little bit about what the community could do to help us fight this COVID situation?
Yeah, I think we have had that question come up. You know, how can we help? And of course, these retirees coming out of retirement to help us is incredible. That's amazing. But the best way to really help this situation is to get vaccinated. Because if you get vaccinated, then you're not going to end up in the hospital like we talked about. And then that leaves the hospital the capability to take care of all the other situations that come up that normally would come up, like heart attack, stroke, car wrecks, and things like that. So you will be helping your family and your friends and your neighbors by getting vaccinated. So that is the best way to fight this Delta variant right now.
And I know just yesterday we are seeing an increase in people wanting vaccinations.
Yes, yesterday we had 329 people come in to get their vaccine, which is a big increase from what we saw over the last, really the early summer. So that's a good sign that people are, they've been thinking about it, and now they see that it's a smart thing to do. And so, yeah, the numbers are definitely increasing, which is great.
And we really want to thank those that got vaccinated yesterday, as well as have been already previously vaccinated, because you guys are really helping us fight this virus and ensuring that we maintain our healthcare services here now and into the future. And just want to share with you, we have our vaccination clinic open Monday through Friday, 7 to 4, but on Tuesdays we have extended hours which go all the way to 7. And we just want to thank you for taking the time to get vaccinated and keeping our family, friends, and neighbors safe in the Concho Valley. Thank you for your time.